North Dayton Primary Care is home to Dr. Kadakia, who has been in practice over 30 years. Let's meet him now.
So I always wanted to be a doctor because I had three brothers. They were very bright and smart, and they all went into colleges and they all got straight admission to medical school, but none of them continued to become a doctor. They all become engineers. So I decided I had a last chance. I was the youngest in the family. So I became a doctor.
Primary care medicine always appealed to Dr. Kadakia while in medical school.
See, I always wanted to take care of patient as a whole. I don't want like heart and lung and brain. I want to integrated medicine, like everything together. So if I cannot provide particular procedure, then I will send them to a specialist who are trained to do so. But I like comprehensive medicine.
Dr. Kadakia's practice is based on preventive care.
So my practice is 100% based on prevention. So if you come here and I've never seen you, I will find out what you need at your age. I'll ask your like family history, your background, or other histories to see what kind of risk you will have in the future to develop certain disease process. So I'll screen for all those stuff.
Engaging with his patients is very important to Dr. Kadakia, as is education for diseases including diabetes and high blood pressure.
I tell you, a person who is informed about that medical condition will be the best person to take care of because it will make your job a lot easier. And that's what I like the most is I want to make them as much knowledgeable about their disease process as possible. So we give all kinds of resources to them.
Establishing a trust with his patients is important to Dr. Kadakia. Trust, comfort, and compassion are key elements to how he practices medicine.
Make them comfortable, show them compassion. And the patient will have a trust in you. That's the best. I think 33 years, I have learned one thing, that patients, half of their illness or suffering goes away if you communicate them with properly and show them how much they trust you or what you're going to do and how you're going to take care of them. Because see, when the patient come here, they're already suffering. So they're tense, uptight. They may have heard some bad stuff about the disease process or this doctor, what he's going to do or what he's going to do. So your job is to comfort and show some compassion. And that's the main thing, I think.
Upon arriving at North Dayton Primary Care, a patient is greeted by a receptionist. In the examination room, the medical assistant will take their vital signs. Dr. Kadakia understands that no two patients are alike.
Each person gets different care. Some people are shy, some are very talkative, some are very open, some are very frigid. So you got to change your behavior, how you approach the patient according to that particular.
At North Dayton Primary Care, several screenings and tests are able to be done right there in the office.
Yeah, in our office, besides doing medical examination, we do blood work. Now, we don't do blood test here. We just collect the blood and send it to the lab. There's certain blood work we can do it here in the office, like blood sugar, diabetic testing, urine analysis, blood in the stool. We can check those here. We have an EKG facility. We have a pulmonary function test. We do it here. If somebody needs the injection of vitamin B12 or some flu shots or something, when we have available, we do those things here.
Every one of Dr. Kadakia's patients is given a password and instructions on logging on to MyChart, a patient's own electronic tool for viewing their medical records, medications, history, and more. North Dayton Primary Care is located at 7111 North Main Street in Dayton. They are open 8 a.m. to 5 p.m. and closed from noon to 1 p.m. for lunch.